Hi, I'm Harriet Frew, and I write and podcast about the psychology of eating disorders. I've personally recovered from bulimia and have worked as a therapist for 20 years. I hope to inspire, educate, and improve understanding about eating disorders through my writing and audio. Names used are fictional, and stories shared are a combined insight of many client experiences. I believe that full recovery is possible for everyone. We need to talk about chewing and spitting. Chewing and spitting, CNS, is a shameful secret sadly suffered by many people with eating disorders. And it's a potentially triggering and tricky topic to write about, but it's a subject that needs a conversation and raised awareness. It's often overlooked in regular eating disorder assessments as not recognised as an official disorder under mental health classifications. But you can struggle with CNS if you have anorexia, bulimia, binge eating disorder, OSFED, or disordered eating. And it might be something you experience occasionally in addition to other behaviours such as purging or over-exercise. It may be something that you struggle with multiple times per day. So what is chewing and spitting? So as the name suggests, you chew your food, then spit it out. You wish to enjoy the taste of the food without the calorie cost. Your forbidden foods are normally the preferred choice, as the behaviour is often rooted in restrictive eating patterns. And this dietary restraint might include delaying eating, not eating enough, or eliminating certain food groups. Outside of CNS behaviours, you're probably feeling hungry and deprived. And initially, when chewing and spitting, it may feel that you found the answer to eating and weight control. Surely it's a way to eat all the delicious prohibited foods whilst not impacting your waistline. But this is far from the truth of the matter. It can wreak destruction on your physical and mental well-being. So what are the costs? Number one, the impact on digestion. Digestive complaints are often rampant when CNS exists. When you chew food, your stomach produces acid in anticipation of digestion. The food doesn't arrive in the stomach or only does in part, and this can lead to painful stomach cramps and bloating. It can lead to ulcers and acid reflux. Irritable bowel symptoms can become your normal. Number two, the impact on your teeth. Chewing and spitting often involves chewing on huge quantities of highly palatable foods that you would normally deny yourself. These foods tend to be high in sugar, and as an eating disorder therapist, I firmly believe that there are no good or bad foods. However, chewing on colossal quantities of sugary foods, sometimes multiple times per day, will wreak havoc with your teeth, and this can lead to dental caries and gum disease. Number three, weight gain. CNS does not appear to be a magic weight loss tool. Some food is swallowed and absorbed despite best efforts to the contrary. Research also suggests that you may overeat later in the day following a CNS episode as your body is out of sync with hunger and fullness cues. Your body becomes confused and hungry. Number four, an addictive feel. Chewing tasty food can deliver an opioid hit to the brain, bringing an amplified feeling of reward. It feels addictive and compelling. Quickly, though, it can become a destructive habit that feels challenging to stop. It's infiltrating into precious moments throughout your day. Number five, isolation and shame. If you're not convinced by the injurious physical impacts of CNS on the body, the emotional impact is profound. And it's very challenging to talk openly about this behaviour. You may experience intense embarrassment, shame, and loneliness in dealing with it. It taints your daily life as a secret and isolating obsession. So working to stop CNS. You can recover from CNS behaviours, although you may need to seek professional support in doing this. But here are some thoughts to help. Number one, motivation. To improve motivation for change, it is vital to engage emotionally with the costs of this behaviour. So be honest with yourself about the impact that CNS has on your life. And this is not to chastise yourself, as you absolutely need compassion, but for you to develop a different relationship with the behaviour. Also, understand the benefits of continuing. Maybe you're using CNS to escape, soothe, or relieve boredom. Maybe you're using it as a weight management tool. When you're clear of the perceived benefits, though, you can consider new and healthy alternatives to coping. Number two, restriction. If you find yourself engaging in CNS behaviours, you are likely restricting your eating by not eating enough, eliminating food groups, or delaying eating. You might be depriving yourself of the foods you genuinely enjoy. So you need to work on allowing yourself to eat enough food and to gently introduce your old forbidden foods in a non-CNS sitting. This might involve eating with a friend or at a cafe, and you might need to plan a distraction activity afterwards when anxiety is running high. Number 3, mindfulness. CNS can be experienced as a numbing frenzy where food is not tasted or savoured. Sitting down at a table, eating slowly, and allowing yourself to appreciate and engage with non-CNS eating experiences can be valuable. Number 4, emotions. Unexpressed feelings will be bubbling under CNS, although you may not realise this. It can be used, as with other compulsions, to release pressure and let off emotional steam. Reconnecting with your emotions and practicing deeper self-awareness will help with this, and other healthier coping strategies can then be put in place. And number 5, perfectionism. Interestingly, my experience to date shows that people struggling with CNS tend to lean towards clinical perfectionism. The pressure to be perfect and achieve is compelling, and it leaves a wide chasm between the self shown to the world and the authentic inner person. CNF seems to be a relief vent against this relentless perfection and almost an unconscious outcry against the pressures associated with this. Practicing self-compassion and reducing the inner critical voice can significantly help. If you're struggling with CNS, you're not alone, and you may wish to consider getting further support through counselling.